Hello, I'm Dr. Sandeep, one of the doctors here. Am I talking to Fatima, mother of Sarah?
Yes, doctor. I am.
Hello, Sarah. How are you doing today? Hello, Fatima. How are you doing today?
Uh, Doctor, I am good, but I am really upset regarding the condition of my baby. So, can you
Yes,
tell me, update me
yes, Fatima.
regarding?
Yeah, I know it's a very much troublesome journey for you, and we are trying to manage Sarah. She's premature and uh, you are a very strong mother to face all this situation. So today I am here to update you regarding your child's condition. So can you please tell me anyone of our team talk to you?
No, they just informed me.
Mm-hmm.
They just we are going to do this jelly scan for the brain, but the
Mm-hmm.
result is no one informed me. Can you please share me the report? What it
Okay.
report?
Okay, sir. I will explain you everything. So before I start, I would like to know, do you want anyone to be with you?
No, doctor. Right now I am alone, and
Okay.
my husband is also he has
Mm-hmm.
gone to office.
Okay, okay,
So
Sarah. For the babies who are born before date, we usually do the jelly scan, and jelly scan of Sarah is it's showing some bleeding in the water spaces of the brain. We call it as intraventricular hemorrhage. Have you heard about this before?
no, doctor. Oh my God, it is
Mm-hmm.
bleeding, doctor. What it is
Mm-hmm. Yes,
really?
I'm really sorry to convey you this report, and I can understand this is a very tough situation for you. So, if you want, I can explain you further.
Yes, doctor.
So,
Tell
if you
me.
can follow me in this diagram, like this is our brain, and inside brain there are water spaces called as
Mm,
ventricle. And
mhm.
inside these water spaces, this bleeding has occurred. Is this clear so far, Fatima?
Yes, doctor. But how it occurred bleeding, doctor?
Yes, Fatima. Actually, the baby is very small, just 26 weeks gestation. Uh, in this age, the blood tubes which are supplying blood to the brain are very fragile. Like they can break with even with minor changes in the brain. So one of these blood tubes ruptured and this bleeding has occurred.
No, doctor. It is my fault. Or is it our fault on our parents?
No, no,
Why?
Sarah. No, Sarah. Please don't blame yourself. Actually, this is because of baby has born before date, and his blood tubes and all the tissues are not matured, which would have been matured if the baby has born before born on born after completion of the term. But because of something, some incidences, the birth has occurred early. You are not at fault at all.
Doctor, is it severe? Or it is,
Uh, yes, Sarah, I can understand your uh, situation. I can say that the depending on the level of bleeding, we grade this bleeding as grade 1 to grade 4.
mm,
1 being the mild and 4 being severe bleeding. So Sarah has grade 3 bleeding.
mhm. So, do you think that is doctor is problematic? That is, it is really bad. The serious one has any long-term impact, and how you will doctor manage this one?
Yes, Fatima, regarding long-term prognosis, it is very early to predict anything. However, like in the current moment, we will monitor Sarah, like we are monitoring her blood pressure, heart rate, and we are monitoring her head size. We are monitoring for development of any fits. In the long run, also after recovery, we will monitor Sarah for the same head size and growth, and we will monitor her development, like how she is developing, any issues regarding understanding or any uh, motor development, like walking and sitting, running, everything we will follow. Are you following me, Fatima?
Ye- Yes, doctor, but I am again concerned. This bleeding may increase, doctor.
Actually, Sarah, we have no control with this over this bleeding, but like we are monitoring further and we are taking care so that we will come to know further if any development has occurred and we can intervene accordingly. But like it is very difficult to predict whether this bleeding will occur again or no. We can monitor and we can uh, manage if any complications occur in between. Are you following me, Sarah?
Yeah,
Fatima?
yes, doctor. So just I want to, doctor, ask, can we stop this bleeding or whatever it is occurred?
6 minutes, 3 minutes remaining.
Mm-hmm. Actually,
So can
Fatima.
we halt
Hello, Fatima.
on?
Hello.
Yes, doctor, tell me.
Actually,
Hmm.
right now we are monitoring Sarah, and we are maintaining her blood pressure, and we are handling the child with utmost gentleness. That will help to help in some extent. Also, whatever the bleeding has occurred, we cannot remove by any surgery or something, like, because it is not like outside bleeding; it is deep inside. So right now we are monitoring and managing the complications. Also in future we will monitor, as I explained before. Also, if any physiotherapy or any medicines required, we will definitely intervene as and when required. Is this okay, Sarah? Fatima?
Yeah. What other, doctor, complications? As you told, long-term complications. Can you tell me again which
Yeah,
complication?
there is possibility. It is very difficult to predict because each child is different, and uh, further what complications will occur, like very difficult to predict. But there can be some developmental issues, like there may be some delayed walking or standing, running, or there can be some difficulty in speech or understanding. But like it's too early to predict all these things. Maybe with Sarah, there can be some recovery which we will come to know with the time. Okay, Fatima.
So yes, doctor, I got your point. Just tell me that if suppose bleeding it is going to increase. So then how that you bleeding that you will manage? Then can my patient, this baby, die of this heavy bleeding?
So Fatima, I can really understand the stress you are going through. Oh, I can say like Sarah is in a bit critical condition. However, we are trying our best to manage, and we are trying our best to support Sarah through this critical situation. Okay.
Okay.
Okay, I know you may be having further questions. So if you wish, we can arrange up another meeting for further discussion if you have any. So right now, if you allow me, I will summarize the points which
Yes.
we are going through, which I have gone through. Okay.
Yes.
So
Yes.
today I have informed you that Sarah has bleeding in her water spaces in the brain, and it is grade 3, and we have discussed what will be the further course and what will be the long term problems and management. Okay, Fatima.
Time's up. Time's up.
Thank you for the time.
Yes, doctor. Thank you, doctor.
Yeah, Sarah, Fatima, Sarah, Fatima.
It is
Yeah.
really the intermingled. Sometimes we same name. This female. Yeah. Yes, Sandeep.
बोलो, अभी तुम
Yes.
बोलो,
सब
अब बोलने का.
कोई बोलने का, nothing true. Except I think at the offset,
हाँ.
group. You didn't greet, no?
Yeah, I said hello because like it was a breaking bad news. No, I did not say good morning.
Mm-hmm.
I
And this
said hello, how are
congratulations.
you?
What about this congratulations?
No, no, we are breaking a bad news. No, so no.
Mm-hmm.
Already baby is 5 days old.
And on ventilator, true.
If it is a good thing, we can congratulate.
Mm-hmm. Otherwise, repo, this introduction, and also body, uh, it was complete from, I mean, in all aspects.
Tamanna,
Yes, boss.
I think
Hmm.
you joined late, no? Or you were there since beginning.
I think 5 minute. Which one scenario I want to? I will do.
Intraventricular hemorrhage, talk to the mother.
Okay, talk to the mother. Okay,
Hmm.
okay.
Tamana will
I
do. You are
I will.
asking feedback.
Yeah.
We did just finish now, Dr. Tamana, this one.
Okay, okay.
Mana is tired of her giving lectures, so she thinks it's a topic. They're asking for feedback. Dr. Tamanna, the one Sandeep he did. I think she joined late, probably.
Yes, yes, yes.
Yes, I was in another room basically. That's why.
Hmm. So, Dr. Hiren, you can give some inputs. Otherwise, we can move to next.
Yeah, I think it was good. A few point of time, I feel the sentences were long.
Mm-hmm.
Otherwise, you covered up the things, and I'm not sure whether
What to say
we
if the
did.
mother is saying that will this bleeding increase or no?
Yeah, there is uh, not major no medicine which we can control this,
Mm-hmm.
but we can do serial scan and we can monitor.
Okay.
And neurosurgical intervention, I'm not quite sure whether we have to bring this idea into this discussion or not. Some people they say neurosurgeon for shunt and all. I don't think it's a safe thing to bring for hydrocephalus and all. Like some people they say yes, because of bleeding, the head size will increase, and then what to do if you're not able to
Like,
walk and all.
yeah.
If you bring neurosurgeon in picture, it might drag you into another direction, or if you can wind up nicely, it is a good thing.
Okay. So we will do next one. Pause it.
You are a neonatal registrar in a district hospital, and you are working in a postnatal ward. You are talking to a mother. Her name is Jani, Mrs. Jani. The background is that 12 hours back, she delivered her son named Billy through normal delivery by a midwife at home. Right? The baby is perfectly well, but the midwife and the mother noticed that the baby physical appearance are not like her other children. So they brought her to the hospital, to you in fact, just to have a look at the baby and give your expert opinion. You saw the baby and you felt that the baby seems Down syndrome. So just you have to talk to the mother about this.
Mhm. Okay. So who is keeping the time?
Yeah, I will tell you.
Oh,
I'm Mrs. Jenny, mother, and the baby name is Billy.
yeah, fine. Just give me 2 minutes.
Can someone please share this paper of the examiner sheet for communication? If anyone have, just screenshot, please.
Start.
Hello, good evening.
Yeah, good evening, doctor.
I am Dr. Hiren. I believe I'm talking to Jenny, mother of Billy.
Yeah, doctor, right.
Congratulations, Jenny. How are you doing? How's your health?
Yeah, thank you, doctor. I'm feeling quite good. Thank you.
That's good. Jenny, today I'm here to discuss with you regarding Billy's health concern. Would you like anyone else to attend with you this meeting?
Yeah, doctor, my midwife, she is a very good friend of mine and she's always caring for me. She is outside with me. So if you please just call her. Thank you.
Yeah, that's fine. Yes, I will call her and we'll let her attend together with us. So, Jenny, before we start, did any one of us, our other team member, spoke to you about some of the findings which we have noticed on the Billy?
Well, doctor, I'm very much concerned because one doctor came. He was probably a junior doctor. He saw Billy, and they just whispered with each other, and they left. Since then, I'm very anxious. Please, doctor, tell me what happened.
Yeah, let me reassure you, Jenny. First of all, Billy is looking fine and he's good. We have gone through some of our regular baby checkup. What we have found, there are some facial features and some of the physical appearance is slightly different. Are you with me?
Yeah, doctor, what you said, different? No, he looks normal to me, only just the eyes a bit funny. Otherwise, he's a normal baby, doctor. What are you saying?
Yes. So I'm I believe you have had a close look with the Billy's, right?
Yeah.
Yeah, as you said, I agree with you that he has slightly different eyes, but otherwise looks normal. I totally agree with you. He has a slightly different eyes, and there are some features like there is a if you see the hands, there are the crease little bit difference. All these features which suggest the possibility of the condition called trisomy 21 or Down syndrome.
Wait, doctor, come again. You are saying there is some serious problem with Billy. Please.
Jenny, I can imagine it's likely it is kind of little bit new information and little bit difficult to get through it. But let me tell you, this is the condition which we are suspecting. But at this moment, we are not very much sure about this. But uh, the physical features which we have noticed, which tells us like possibility of the Down syndrome. Have you heard about the Down syndrome?
No, doctor, it's a very scary term. I'm hearing it for the first time. I hope nothing serious.
Yes, Jenny, I will tell you about this. It is, let me tell you, it is not a serious condition. It happens because of the one of the the chromosomes which are the responsible for our color of the hair, our skin color, and the nails. This chromosome is called. This is one of the. There is one of the extra chromosome, and because of that, this condition happens. But I will tell you, still we have not yet confirmed this, and we are planning to confirm this by sending some of the blood tests.
So, doctor, you have not confirmed. So this is a good news. Means it cannot be. So, what blood test, doctor, you will take? I'm very worried. Please take it now.
Yes. So we will send the blood test for the chromosome analysis. And I would like to also tell you here, like in this condition, what happens. There are possibilities of some of the um, problems with the heart, like there can be some hole in the heart in this condition. Also, there can be possibility like uh, they have a little bit weak muscle, they can have some difficulty in the feeding, and uh, these problems can be still managed and sorted out with the help of the multidisciplinary team people, which includes the heart doctor who can manage whatever the heart problem if we find. And regarding the other issue, there is a like a development issue. There is a community pediatrician. They can look over this problem. Are you with me?
Yeah, doctor, you said things which are very difficult. They are very hard things. It seems that Billy is in serious problem if he has Down syndrome. But doctor, can I ask you? I think this is my mistake.
Jenny, I would like to tell you it is not your mistake. It's a matter of a chance, and it can happen to anyone. But fortunately, it has happened to you, but it is not mistake from your side at all. Do you have any other concern, Jenny?
Yeah, thank you, doctor. But you told me there can be heart problems, where the child can be weak. So is this a treatable condition, doctor? He will get some medicine and he will be cured?
Yeah, this is a very good question, Jenny. It is not kind of the treatable condition, but what we can offer, there is a team of the doctors which can definitely help in a better quality of the life. For example, if there is any hole in the heart doctor can help. If there is any difficulty in speech and language, then the uh, doctor of the ear can help into that. And with the difficulty in any development and issue with the cognition, the psychologist as well as the community pediatrician can definitely help into that. I think I gave you a lot of information and it's very difficult to take into in a one sitting. If you don't have any other concern, can I go through the salient point which we have discussed today?
Oh, doctor, you're very right. A lot of things are going into my mind. And yes, you can. Thank you. We will. I would like to have another session with you because now I'm very much disturbed. So yeah, thank you.
Yeah. So you are most welcome, Jenny. And I would just like to go through the points. So today, what we discussed is regarding this condition, how it happens, and what are the possible complication it might happen along the course. And we also discuss about the other team member which can be helpful in dealing with this situation. So I would like to also give you some of the leaflet you can go through, and if you have any other concern, you can arrange it next meeting.
Okay, I'm finished.
Yeah, thank you.
We have
All right.
6 minutes.
Yeah, this was 6 minutes or 9 minutes.
9 minutes. We have 6 minutes now to feedback because only 6 minutes.
Okay, so first I'll give my feedback. And I'll start with my negative feedback because there is a lot of the positive things. So I'll first give the negative one, then we'll come about the positive one. First of the first point I was actually noting when I was doing communication. These are very minor points, but I think we always, when we do out of the blue communications, then we forget these points. Number first was that I told you that the doctors whispered and I felt very anxious, but you didn't show any empathy about that. You should have said that, oh, I feel very sorry about the doctors that they behaved this way. Number first. The second, I felt that the throughout, like it was a monotonous type thing from your side. Your voice was not coming up and down. Like I think it should come up and down along with the emotions of the role player. The other thing you used chromosome. I think it's a jargon. I don't know. Maybe it is in UK. It's not a jargon, but you said extra chromosome and all that. So I don't know. Dr. Tamanna can comment. You can comment. Okay. The other thing, when you started to tell me about the
What
Down
to
syndrome.
tell if there is a, I mean, like chromosome, once you justify that it is the responsible for our hair and color and nails and this. I know it's considered as one of the jargon. But if there is no terminology, then use the jargon and justify it.
Okay.
That is one of the way. Like when there is no other alternative, I don't find any alternative for the chromosomes.
But they say if genetic material you can say, or you can explain it. You use the term chromosome and then explain it. Yeah. The other thing that when you started to tell me about the Down syndrome, you straight away went into a hole in the heart. So it's very disturbing for me. Like if you're talking to a mother, I think it should be a burger approach. You should tell the things which are not worrisome to the mother, then come to the worrisome things, and then come to the again to some soft things like burger approach. Straight away saying hole in the heart, I think doesn't sound a bit good. Anyhow,
Yes.
okay, and then at the end, I said I'm very much disturbed and I'm very much upset, and you didn't show me any empathy. You said, okay, we will conclude this. So this was something, and you used one word, multidisciplinary, and you like just said that a heart doctor, and that's all. I don't know now this is a normal word or jargon. I don't know this. So yeah, multidisciplinary team.
I don't think it is a jargon.
Yeah, I don't know this thing. Yeah. The positive things, like it was the out of the blue communication. You were very systematic. You just started with me. Your greetings was very good. The entering into the communication was very good. Yeah, the body was very good. The finishing was good. Yes, all the three portion was good. Only these two, these 3-4 things feedback. They are just the communication mistakes, not like the verbal mistakes. Otherwise, you were very good. And I think, yani, I can give you pass. Not clear pass, but I can give you pass.
But I agree with your one point, like what you said. I missed the burger approach. That, I mean, totally it went out of the mind. I should have speak something like there is something good, normal life they have. At the same time, they have some problems which can be dealt with the team of the doctor, like heart doctor or ENT doctor, like this.
Yeah, this is how we improve ourselves. But if you do, but for something which you don't know and communication comes to you, it was excellent.
Okay, now
Thank you.
Hello. Now Dr. Tamanna and Dr. Pankaj both are not there. So if Dr. Jay and Dr. Tahir, if any of you wants to do a communication, we will log in again. Otherwise, we'll call for the day.
So ideally, this scenario, this is this Down syndrome. Sometimes we feel when we are very much prepared, then we feel like how much information we need to give, and we are not like out of the blue it comes. Then
See, exam.
you have to balance the information. I think that is very important.
Yeah, that's why I selected some topic which is very common.
Good.
And I mean, when we think we always search for fancy things, but
Mm.
at the end, the common things come in exam and we get hit. So I think the approach was very excellent from your side. You did not went into the detail of the Down syndrome at this time because this is your first meeting, and it was just telling Jenny that Billy has some problem. You are not going what is the problem, what is that, because you are not sure yourself, because it can be a mosaic and everything can be normal. So you said you will do the blood test first. So this was, I think, the point which I give you pass. If you did go into the detail of the Down syndrome, that there can be obstruction and there will be this and there will be eye problem, there will be